Kay, it's wonderful to have you on NAFTA.
Hello, Chris. It's great to talk with you again.
I would like to read a statement as we move into this show, but it has very serious national implications, including the fact that over 700,000 Americans receive dialysis services funded by the CMS, the Centers for Medicare and Medicaid Services. And the number itself seems to be growing, which I believe is part of the motivation for the Total Kidney Health Program. What are your thoughts about that?
Medicare spends over $130 billion on kidney disease every year. Greater than $81 billion is on chronic kidney disease, and probably over $50 billion is on kidney replacement therapy, which could be dialysis or transplant. Along with kidney disease, there are cardiovascular diseases, diabetes, which also account for significant Medicare costs.
And frequently those are comorbidities of people who are on dialysis.
Absolutely. This is where we have an opportunity to address those conditions with care management and value-based care.
May I read a brief statement here just to set the stage for our discussion today?
Sure.
The goals of the KCC, the Kidney Care Choices model, are to prevent or slow the progression of kidney failure for beneficiaries with stage 4 or stage 5 chronic kidney disease, improve care management for beneficiaries with ESRD and stage renal disease, and increase rates of home dialysis and kidney transplant. The core participants in this model will be nephrologists and nephrology practices, but they may partner with other clinical care providers, including dialysis organizations and transplant centers. That is a huge mandate, but it's driven by so many factors.
Exactly. Just to recap, there was the Advancing American Kidney Health Initiative of 2019, and subsequently, models that rolled out afterward, one of them is the Kidney Care Choices model, have brought value-based care to nephrology. In this particular case, what we're doing in Total Kidney Health, that is a Kidney Care Choices model, which is specifically the kidney contracting entity model option, which is one of the comprehensive kidney care contracting options designed to operate for 5 performance years. So as you mentioned, this is an optional model which brings together care teams and nephrologists and the dialysis provider, which is Satellite, to treat patients with late-stage CKD, specifically CKD stage 4 and 5, and patients with ESRD or kidney failure. The model also aims to realign incentives to maximize non-dialysis care, and there are also different levels of risk for the participants to opt for.
What will be the same and what will be different when a patient is part of Total Kidney Health?
Their doctors stay the same, their insurance stays the same. What's really key is that this is of no cost to patients. So if I'm speaking with a Medicare patient, Chris, I can say you will have a dedicated care team who can help you get the care and support you need. Personal care navigator who can make your life a lot easier by helping you set up appointments and helping you coordinate your health procedures and connecting you to other people on the care team. There's also going to be a nurse care manager who you can call when you have a health concern and teach you kidney disease education. For example, about your blood pressure or coronary artery disease or diabetes, and visit you when you have a health event.
In addition to the patient's care navigator and care manager, Kay went on to describe some of the other members of the Total Kidney Health team.
You'll also have a dedicated social worker. They can also connect you with community-based services for your basic needs and help you understand your health insurance, find more affordable medications, and connect you with an interpreter or behavioral health therapist. And 2 more people who will also be with you on your team is a clinical pharmacist who will help you understand how, why, and when to take your medications. Work with your pharmacy to make sure you get the help you need with your medications. And the last very important care team member that you will have as a Medicare patient is a kidney transplant coordinator. and educate you and your loved ones about the transplant process and help you get a transplant referral and evaluation, and then follow up with you for your appointments and monitor your care after your kidney transplant.
Why is this program so positive for nephrologists, and what value does it bring to nephrologists and their practices?
So if a nephrologist were to come up to me and say, how is Total Kidney Health going to help me? I would say you will be able to achieve better quality of care for your patients, improve resource utilization, you'll improve your patient outcomes, save costs, and avail of financial incentives, and you'll have the opportunity to participate in a value-based care environment, which we know, Chris, is the future of healthcare in the US. Most importantly, you will have a comprehensive care team to expand your support services for patients. One of the important things to bring up is the increase in physician burnout, and having a comprehensive care team supporting nephrologists and taking care of their patients will increase their individual satisfaction. They will know they have support in providing the best care possible for their patients.
We know that optimal starts means patients receive a preemptive transplant or start dialysis therapy in an outpatient setting, and there will be emphasis on this in Total Kidney Health. Can you expand on that?
Let's start with PAM, which is the patient activation measures, which really represents a patient's level of knowledge about their care and their ability to self-care, meaning take care of themselves. One of satellite healthcare's fortes has always been patient education, and patient education is going to be key for improving PAM scores. So, moving on to optimal start, as you mentioned, this is a planned start to dialysis with a permanent access. It could be a peritoneal catheter, a fistula, or a graft, or preemptive transplant, or conservative management, which is care without dialysis. The goal is to avoid the crash starts in a hospital setting,
Absolutely.
which unfortunately makes up the majority of dialysis right now. And the last one is the PHQ-9, which is the depression module. Behavioral health and mental health impacts almost everything we do. And that includes our decision making, lifestyle choices, and even adherence to treatments and medication. It will impact a kidney patient's modality choice when they do reach end stage kidney failure. So, integrating behavioral health care will be effective for improving patient outcomes and engaging patients in their care and treatment.
I read a study published by the United States Renal Data System, USRDS, where researchers found that before end stage renal disease beneficiaries started with their first ever dialysis, they discovered that only 0.9%, that's less than 1%, received kidney disease education services before their dialysis started.
It's a very sad reality, Chris, and that's why I'm so excited. Our very talented brand team at Satellite Healthcare has, in the past year, designed over 43 patient education topics, over 2 dozen for chronic kidney disease, over a dozen in kidney transplantation, and really, all of these topics will contribute to CMS's program, the Center of Medicare and Medicaid Services program of kidney disease education, which has been expanded for these value-based care models to include CKD4, CKD5, and the first 6 months of ESRD patients. CMS has also eliminated the copay to really encourage patients to opt for kidney disease education and remove those barriers. If we incorporate more patient education, we will find that this is key to patient decision making and empowerment, improving self care, and patient outcomes.
I feel that CMS, the Centers for Medicare and Medicaid Services, made a very enlightened move by including the PHQ-9, the depression module, as a quality metric in KCE. Why did they take that action?
Just to reinforce behavioral health and the importance of mental health and care management and making sure patients are involved with the decision-making process, activating patients to be part and parcel of their entire care planning. What we're seeing in the last few years is CMS really emphasizing more population health, more social determinants of health, mental health. We're going to see moving forward that integrating behavioral health care will be driving those patient outcomes.
What, in your experience, are social determinants of health?
That involves everything from socioeconomic factors to environmental factors, housing, food. It's really just incorporating everything that is beyond the medical treatment. And this is what I think our social workers really do so well, and why it's so key to have social workers as part of the integrated care team for patients.
How will care management implementation in total kidney health assist patients and produce value?
Care management increases patient engagement and helps in the day to day management of patient care. Patients will feel and know they have a care team that is supporting them, and that's what we're aiming to do in Total Kidney Health. And care plans can also help organize coordination of actions to improve patient self management. These care plans are personalized for each patient, including tasks and goals for both the patient and the care team to track for better care coordination. In Total Kidney Health, patients will receive care coordination and care management, which will help to prevent hospitalizations and readmissions by getting ahead of health events. And nephrologists will receive financial incentives and government payments for providing better care and improving outcomes.
Talk about the role of telehealth in delivering total kidney health services.
Telehealth has given patients access to quality care, and it has greatly increased patient engagement. So, when we talk about telehealth, it's really everything. It's the use of the internet to access our health information, send messages to our care team, fill prescriptions, or update our insurance, even make phone calls and send secure messages. So even if a patient may not be able to visit their care team in person, if they cannot leave their home or due to time constraints, they can now remotely reach their doctor and get a consultation. And also, this is great for all the physicians. Chronic kidney disease and other chronic conditions require continuous follow-up and monitoring. So this helps physicians remotely monitor and manage their patients. We're going to see improved patient engagement, which is so critical, and also provider engagement, and it'll improve clinical workflows and practice revenue and reduce overall healthcare costs.
Data and analytics are a part of value based care. How will data and analytics contribute to the care model?
Data and analytics will give us insights into better care management and care coordination. The care team can gain detailed information by doing a deep dive into patient data. And we're going to have a population health dashboard, which will also help to display more high risk alerts to follow up on and reminders pertaining to each patient. We're also going to be incorporating ADT feeds. So, ADT feeds are admission, discharge, and transfer feeds, which will come from hospitals, and they will also help the care team take action in real time and follow up with post discharge care and visit. I'm very excited about all that we can integrate into this program.
There is an emphasis on home dialysis here, which is incentivized. Also, to encourage patients to have transplants much sooner than later, even before they start dialysis. That's a very tall order. How will that work?
We have the advantage, Chris, in the Medicare population of trying to encourage more preemptive transplants because we don't have the insurance that may be a potential financial barrier for patients. We know that from a lot of research papers that home dialysis and transplantations produce the best patient outcomes, and also patients have greater longevity with these two modalities. Our goal is to really, by moving upstream, by managing CKD 4 and 5 patients, educating them about the different options, to give them time to transition to these much better modalities if they are able to, and really give them the confidence to take this on.
And one of the goals is to avoid or evade the acute initiation of dialysis. People who experience that have higher mortality rates than individuals who have not avoided the acute setting, the crash, as you say.
We want to prevent the crash-ins. We want to make sure that they start dialysis in an outpatient setting. We want to make sure we have enough time to place a peritoneal catheter or a fistular graft so they have that optimal transition. Or even if they're undergoing the transplant process, that process can take up to a year or longer, especially now with delayed times for elective surgeries. And so we want to really ensure that they have enough time to opt for these modalities, which are really going to be better for them in the long run.
Why did satellite healthcare decide to take the plunge, as it were, and join from the beginning of this program? Why was it important? And to further complicate the question, this is very crucial too, how does it reflect the culture of patient service?
Satellite has been a pioneer in innovative patient care and quality outcomes, and much of what is being incorporated in Total Kidney Health is what Satellite has been implementing for years in having an integrated care team support kidney disease patients. Similar to many needed reforms in our society, we can either sit back and wait for change to come to us, or we can pave the way and be the change, be good change, and be positive change. And, the last time we talked, I mentioned value based care being a train that has arrived in healthcare and that we all need to get on board. And I will kindly add to that and say that satellite healthcare strives to be the engine of that train in the kidney space. And at this moment, Total Kidney Health is the engine driver.
What does success, what might success look like to you with Total Kidney Health?
There is, I think, what I would say is a quantitative and qualitative component to success in Total Kidney Health. So quantitative success would be decreased mortality rates and increased rates of preemptive transplantation and home dialysis, and slowing the progression of chronic kidney disease and more optimal starts and improved patient activation and mental health, which also will manifest with less hospitalizations and ER visits. If we do all that, we'll have demonstrated comprehensive care management and improved patient outcomes and reduced costs. And then, Chris, there's a qualitative component of what success looks like in the Total Kidney Health. It is about delivering a compassionate approach to care delivery, having humanity, and taking care of our fellow human beings. It's about improving patient lives and walking with them on their total journey from living with chronic kidney disease to end stage kidney disease to having a kidney transplant and post transplant care to coping with dialysis or care without dialysis. It's kidney care for life and letting patients know you are not alone. We are with you every step of the way.
And ultimately reduce the number of people who find themselves experiencing end-stage renal disease, chronic kidney disease, who are compelled to go on dialysis. Is that the ultimate goal, to reduce the patient population?
Yes, I think the big shift is to try to keep people off of dialysis. So if we can better manage care for CKD patients, chronic kidney disease patients, we're going to improve patient outcomes and we're also going to be saving costs. And I think both of those together is a win-win.
And thank you, Kay, for joining us today on NEF Talk.
Oh, Chris, thank you for discussing Total Kidney Health going live. We are all very excited about the program and we look forward to letting you know how it's going later this year. Thank you so much for your time and interest. It's been a pleasure.